Should you be considering non-surgical or surgical hair restoration? In this video, we're going to dive deep into that. But first, I need you to watch the video prior to this called What's Causing Your Hair Loss, so you know how you're making your decision. Now, testosterone is circulating on your body, converting it to DHT. DHT is binding to your hair follicles, causing the metabolism to decrease. And with that decrease in metabolism, the hairs are getting thinner and the body is decreasing the blood flow to this hair follicle. And that's really the end-all be-all that was discussed in the previous video. Is that blood supply restorable enough to get that hair follicle to produce a thicker hair? Well, researchers say that this is the critical breaking point here is when the hair is about 50% of its original thickness. Below 50% of the original thickness, just believe it's hard to restore the blood supply and to get the follicle rejuvenated to produce a thicker hair. However, above 50% original thickness in hair, we believe the blood supply is still plenty enough that it can be improved to create a thicker hair. And that's really the cutoff point. Is the hair 50% of its original thickness or more? Can we try to restore it with medical restoration? That's medicines, devices, and office treatments. Or is that hair below 50% original thickness and we need to replace it using surgical techniques such as transplantation? Well, it's kind of hard to know whether your hair is 50% its thickness original, not having experience. Sometimes you can take your fingers and run it through the sides of your hair, get to feel for what thick hairs are, and then go on the top of your scalp and feel if it feels thinner. But another quick and easy, dirty way to look is just look at your scalp. Do you see more hair than skin? If you see more hair than skin, it probably means that the hairs are 50% the original thickness or more, because it takes about 50% of your hairs to be lost before you notice hair thinning. If you see more skin than hair, that means you probably lost more than 50% of your hairs, and that area is probably something that can't be restored without surgical means. Now, if you're someone who's trying to move your hairline forward, this is genetically a little bit high, obviously those hair follicles are never there, and hair replacement is the only way to accomplish this. So in your consultation, one of our goals is going to be what areas of your scalp can be restored medically that do not require surgery at this point, and which ones actually do require surgery to essentially achieve the goals you want to. Now, we never want to push people into surgery. We actually encourage you to do non-surgical options first, especially if you're young. That way, in our office, we do have tools built in such that if non-surgical does fail, the physician's fee can be transferred over to your transplant to assist you with your transplantation, so you can undergo an option that has less risk first without feeling like you're financially making a bad decision.